Hello, my name is Andrew, and I am providing feedback to the reflection that we had in class about the hearing voices. So the first question is, how did your feelings regarding schizophrenia change during or after the exposure? So my feelings beforehand were I didn't really understand it, and I didn't really know what they were going through at the time. And I feel like this video and this presentation was able to help provide a perspective that I didn't understand at the time. It also allowed me to gain a knowledge of how they cope with lives and how difficult this can be. Beforehand, I did not really understand how difficult it was for them to cope with this diagnosis. For the second question, it says, did this remind you of anyone you see in the street or around town or in, say, movies or novels? So not necessarily, because beforehand I was not really looking out for this stuff. I didn't really look at individuals, but after going through this and after going understanding the perspective on how they live with their life, it can be easily noticed. Like if you see somebody that's kind of distant or somebody that's kind of having trouble going through things, you can see that some people, if you really look out for it, can be look at the ground more, not really looking up, look like they're looking at something different. And if you really look out for it, you can actually see it. And in movies, I know this one movie I watched. I don't really remember the name of it because it was a while ago, but it was about this person that would have different types of personalities and would he act like he would just be talking to someone, and everybody was so confused on who he's talking to and think he was crazy. But on the inside, nobody really knew that he was dealing with these voices on a daily basis. So for the next question, it says, was this a realistic way to show you how confusing life can be with this diagnosis? So yes, it was kind of realistic, even though it was just a video and it was just be turned off with a click. It gave you an experience that they can't turn this off as like we can. Like for us, it was just a video. For them, this is their everyday life. So they have to deal with this type of voices on a daily basis and still try to move forward like we do. They still have to go out there and get groceries, work a job. They have to pay bills, but they also have to deal with this sort of negative tone. Sometimes it can be positive. Like I have seen personally that it can be a positive thing, but most of the time it is a kind of a negative thing. Like they're hearing those voices all the time, and it's always kind of driving them down. So it is very confusing life for them to live because they have to deal with this. They have to deal with somebody talking to them, and it's hard to get things done. So, and then the final question is, how might this affect the way you provide care to someone? So, it provides a way of caring because it gives a perspective that you didn't really have before. So, you are able to provide empathy to them by understanding what they're actually going through. Because before, it's kind of hard to know, who are they talking to? You might think they're crazy. You might think they're hallucinating, oh, they might be doing drugs, but, you just don't know. Like, as an outsider, not knowing what exactly goes on, you just might think that they are just crazy. But after going through this presentation and this simulation, you are able to provide care and empathy to them outside of what you already know. So, in other words, it just provides a perspective that you were able to care for. For example, like we had a patient that actually over the weekend that has paranoid schizophrenia, and you could hear him talking to himself, and he would just change drastically. Like one minute he's just talking, sometimes he's laughing, sometimes he's screaming, sometimes he's lashing out, and sometimes he's just perfectly normal. And if you were outside and didn't know about this, you would just immediately think he's insane or something. But he has this type of diagnosis that he has to deal with this stuff, and he has to almost like he has to reply to these voices. But on the outside, we're not hearing anything, we're not seeing anything, but he is drastically seeing these changes all the time, and he can't turn it off. So I think it just provides a certain type of empathy that we're currently not understanding. But so in other words, that's my reflection to the simulation, and it was really a great experience, and really was eye-opening to see how these patients deal with their everyday lives.